Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try to take actions to make a better system for all of us. Before we get started, down below in the YouTube description box, you'll find a link to the free daily Healthcare Advocacy newsletter that is the text for today's video. It has lots of interesting resources. All of the study materials are linked in that newsletter, as well as all of the references and the actions I recommend you take. Let's first talk about coffee and diabetes. 3 newly identified compounds were found to moderately inhibit A-glucosidase, which is an enzyme that plays a central role in breaking down carbohydrates during digestion. Because the enzyme directly affects how quickly sugars enter the bloodstream, the discovery points to possible new functional food ingredients aimed at managing type 2 diabetes. Now, warning, keep taking your whatever medicine your doctor has prescribed if you have diabetes. Now, due to the complex chemical composition of roasted coffee beans, analyzing the composition and potential activity of diterpenes has always been a challenge. This research developed a methodology to perform that analysis. That was the big breakthrough that they had. Anyway, way more research is needed on this before we're able to treat diabetes with just whatever, with food instead of insulin. Anyway, I want to talk about the Affordable Care Act because, as you've probably all heard, the Congress has not extended tax credits for people who need to purchase health care on the government exchanges, Affordable Care Act plans. And it's had an effect. Health insurance exchange enrollment is now trending downward compared with a year ago, according to preliminary data that was released by the Centers for Medicare and Medicaid Services. They put that out yesterday Monday. Anyway, 22.6 million people, including 2.8 new million enrollees, had signed up. It is down about 3.5% from a comparable period a year ago. This total reflects enrollments on the federal platform as of January 3rd and on most state-based exchanges as of December 27th of 2025. And of course, it includes the Your Health Idaho site as well. I did include in the newsletter the CMS report from a year ago, where you can see that they were up to well over I think it was about 24 million people at that point. So we're down quite a bit. I suppose, though, if you really wanted to cull people from insurance plans, doubling or tripling the price of the policy by removing the tax credit, that would do it. If you're to make sure that you can't get a plan. Democrats and Republicans are still looking at it. As far as I know, I think the Democrats a day or so ago sent the Republicans a plan to extend the ACA tax credits. This was according to the Axios news service. The package being discussed largely mirrors, get this, a bipartisan health deal that was due to be included in the 2024 year-end government funding deal before it was jettisoned at the urging of Elon Musk and then President-elect Trump. Thank you for nothing. I want to talk about I don't even have a noun to describe the people that are in charge of the EPA, the Environmental Protection Agency, but it really is like either 1984 or Alice in Wonderland, where everything is backwards. For decades, the Environmental Protection Agency has calculated the health benefits of reducing air pollution using cost estimates of avoided asthma attacks and premature deaths to justify clean air rules. Well, bad news, not anymore. Under President Trump, the EPA plans to stop tallying the gains of health benefits caused by curbing 2 of the most widespread deadly air pollutants, fine particulate matter and ozone, when regulating the industry. According to internal agency emails, that the New York Times had their hands on. In a report that was just released in May of 2025, the Coalition for Sensible Safeguards documented that regulations have a significant effect on productivity by keeping workers safe. So the more environmental protection you have, the safer workers are, the healthier the workers are, and they're far more able to do their work without having to take time off. By reducing air pollution, the Clean Air Act increased productivity, employment, and lifetime earnings by about $4,300 a person. The EPA found that every year these regulations prevent more than 100,000 deaths and millions of lost workdays, and that the benefits of the rules exceed the cost by a factor of 30. And of course, Trump is getting rid of these. Ignoring these extensive benefits makes clear that this decision puts corporations' bottom lines over people's health. Look, to Trump and those bums he's put in place, money matters more than human life. Keep it in mind. Speaking of that, I want to talk about recent news related to abortion. Louisiana pushed Tuesday to extradite a California doctor accused of mailing abortion pills, setting up a likely test of laws designed to protect telehealth providers who ship abortion medication nationwide. This is the second time Louisiana has pursued an out-of-state doctor under its abortion restrictions, with Republican Governor Jeff Landry saying on social media he wants to bring the abortion provider to justice. The two criminal cases pit Louisiana, which has some of the strictest abortion laws in the country, against jurisdictions that have enacted what are known as shield laws for providers who facilitate abortions from afar in states with bans. And this one is just despicable. A Kentucky woman last week was charged with fetal homicide after taking abortion pills. Melinda Spencer, 35, was arrested Wednesday after going to a Campton healthcare clinic where she told staff members she used medication abortion purchased online to end her pregnancy. And ending that pregnancy is illegal in the state of Kentucky. You need to take any action. I want you to contact your congressperson and your senators, and you tell them it's time to restore full citizenship to women. They need to pass legislation that makes the right to choose the law of the land. And I got news for you. You're not just making this crap up. In the Supreme Court decision that struck down Roe v. Wade, they said women are not without political power. If they want abortion rights restored, then get with their representatives and do it. And that's what I'm asking you to do. You can reach them. I'll put a link to the website at Common Cause so you can get their phone numbers if you want, or the simplest method, on your cell phone, send a text message to 50409. That's ResistBot. There's a ready-to-go email right there. The message you send is SIGN, SIGN, and then capital, all capitals, PKZFLM. SIGN PKZFLM to 50409. Here's the message you're going to send. I am your constituent, and I just learned that states are indicting doctors who prescribe abortion medication remotely. A few days ago, a woman in Kentucky who used medicine for her abortion was arrested for murder a few days ago. Women who present at hospitals are suffering failed pregnancies, have been allowed to die rather than remove the unviable fetus that's killing them. Aren't you offended by any of this? Doesn't it bother you that states have set up complicated rules that threaten women and their doctors? This is a matter of law. When the Supreme Court relegated women to second-class status by removing the right to bodily autonomy, they indicated that it could be fixed by passing a law making the right to an abortion the law of the land. I want you to do that. I want you to pass legislation that legalizes abortion nationwide. You can pass the Women's Health Protection Act. And when you've done that, make sure that the Equal Rights Amendment is added to the U.S. Constitution. After all, 38 states did pass it. I expect to hear what you are doing to restore women's citizenship. Thank you. That's what I've got for you. Again, down below, you can like, share, subscribe, pass it on to your friends. You can send me comments and suggestions here in YouTube or at healthcareadvocacy1, all one word, @gmail.com. Thank you.